Dear guests, welcome to the Medicres TV Artificial Intelligence in Health Science program. This is my first international show, so I am very excited about that. Please excuse me. And today we are with Mr. Patrick Hans. Mr. Hans is joining our program from Mexico. Welcome.
Thank you.
And thank you very much for joining our Artificial Intelligence Health Science program. And Mr. Patrick, we know you are the position 20 at Thomson Reuters US top 15 social influencer in risk, compliance and RegTech. But we want to know yourself from you. Can you tell about yourself, please, all details, because we want to know you.
Thank you. So I'm originally from Germany. I studied business administration at the University of Cologne. And here I already had a focus on behavioral science, economic psychology. And I come back to this. So I worked first in marketing, then later I switched or I moved to Mexico City, where I worked at Siemens in their compliance department, so in the anti-corruption compliance department. And later I changed in 2013 to Atlanta, where I'm working in the area of governance risk and compliance. So normally I'm based in the Atlanta city, but at the moment I'm practically as a digital nomad working 1 month here from Mexico City, because luckily I can do my work where I can connect my laptop. Compliance is a lot of behavioral science where I'm very interested in, and with the time I also included my focus on AI to understand why AI behaves the way it does, based on the programming on artificial intelligence, machine learning, and so on, and especially how AI and the human work efficiently together. So I focused my investigations about that topic, and with the time I got the opportunity to become a committee member of the IEEE Digital Reality Committee, where we discuss many futuristic topics, as for example the personal or the cognitive digital twin, and maybe we come later in a different episode to this. And also I became the one of the co-editors-in-chief of the Springer's Discover Artificial Intelligence journal. We have the pleasure to review various articles, or better said, mostly organizing the review and doing some reviews myself, which is a big pleasure because you get papers from all over the world, from professors, students, so you get a lot of fresh views to see.
Oh, very exciting and very long, very good, and all the topic is futuristic for us and very good for us, because we are talking about artificial intelligence, but in health science.
Yeah.
You said all of the topic about artificial intelligence, but we want to learn from your view in health science. What do you think about feature of AI in health science? What do you think about that?
I mean, in general, most of us, we are working together with AI. We are growing together with AI. You may even say that we all became something like cyborgs, as we outsourced a lot of our knowledge to our mobile phone, and practically, and you may try it yourself, you don't want to live a day without your mobile phone. You get nervous, you feel bad, you feel anxious maybe. So we are practically, all humans are already something like a cyborg working together with AI, as we are all having our all knowledgeable smartphone with us. So all of us, independent if we are working in the healthcare sector or any other sector, we are working together with AI. The socialization becomes different. For example, my daughter grew up with the iPhone. She grew up with voice assistants, so with chatbots, and this so her situation is completely different. She's used to using virtual reality in different games or for social meetings, whatever. So people who are working now and in future in the healthcare sector will be different than the doctors we still have today or in the past. Besides this, AI will heavily influence our healthcare sector as thanks to our hyper connection, doctors, independent if they are in the big cities or maybe in rural areas, may have access to expert knowledge from all over the world, which is of course a big help because let's say you're living in a rural area. This does not mean that you are a worse doctor or not on such a high level as a doctor living somewhere in a big city. But as you don't have so many cases, you don't earn experience as fast as other places. So especially here, the connection to global knowledge will be a big help for you. Also, we see, of course, in surgeries that the doctors will work together with, let's say, with a robot arm performing the surgery, or even may use virtual reality glasses. I think this is maybe a little bit more in the future, but robots will support us as they are, of course, able to work more precise than a doctor after 6-7 hours with his hands or area. And on the other hand, we already go into the direction that all of us as a patient, we have something like our digital model, meaning the insurance company or the healthcare provider, whoever, they have a very good information. They have all the information of us and based to different scientific processes. They may understand the interaction which everything can cause. And going from the digital model, we go to the digital twin, as we can send continuously information to the cloud, for example, with our Fitbit, our iWatch, or of course the same also from other companies. So we can send continuously information which for our benefit may be also requested by our employer to show that we stopped smoking, etc. So we send continuously information which will fit our digital model. So you see, I think AI and digital models will enter from all different areas, also the healthcare sector.
Yeah, thank you very much. Recently, artificial intelligence has been one of the hottest topics in the technological world. We know that, and in a health system, we are using all of the parts. For example, you said in doctor using diagnosis, drug development, treatment, personalization, and gen addition or disease prediction, and some of this, a lot of many more. But you say in this part, it's very important for me, robot technology and robotic system. This is special for me, and I want to know about that, but we will talk about robotic system later. First, I want to ask you about the in healthcare system, in healthcare period. In your career, I read about your working about artificial intelligence with ethics, and in ethics system, healthcare service, we are working now, but we don't know the next, and how we will use the artificial intelligence healthcare with ethics system, with human control system, medical professional and hospitals and patients. How will they use the artificial intelligence, and is it will be ethic or not, and what will we do about this? What do you think?
difficult to predict. I think it will be tomorrow, as it's today. A part will be ethical, another part will be maybe less ethical, because, well, if you're speaking about artificial intelligence, AI, what we mostly mean nowadays is machine learning or pattern detection. So meaning the algorithm detects that we have something A and something B, and this is somehow related. And then, of course, you do the prediction that may lead to a favorable or non-favorable status in the future. So practically, we are speaking about statistics. And first of all, that algorithms will be able for such prediction. We need to feed them with a lot of data, as photos, as patient information, whatever. And the more data we feed them, the better will be the predictions nowadays in future. And I think, as most of us, we have heard that algorithms, the same as humans, are biased, and this for various reasons. Because one reason could be because the people who programmed the codes had been not a diverse group. So let's say if all the programmers are the typical old white men, as we have in the discussions today, then there's a big risk that maybe female topics are excluded. The same is if you feed the algorithm with 80% photos of white men, then it has later problems to detect, for example, black women. I mean, you can read such cases.
Yeah, this is very important for bias. This one is very important data.
Exactly, and why is this especially important for the healthcare sector? Because sometimes, depending what problem you may have, a female patient has other reactions to a treatment than male patient. So if the recommendations are based on male patients, the algorithm may suggest something which may be not the best solution for a female patient. That's so there are some of these cases in the healthcare sector, and that's why being biased is, of course, a problem. Another ethical problem is, as you may imagine, the more the algorithm knows about me, the more transparent I am for the algorithm, which is good, because from a healthcare point, the better the algorithm understands me, the better could be the recommendations for me. On the other hand, and this depends, of course, from country to country, with the public healthcare system, the insurance system, there may be a problem, because if the algorithm understands that maybe I'm not in such a good shape, automatically my costs will go up, as of course the insurance companies want to earn money. So they may bias against patients, which potentially would cause higher costs for them. And so this would be another potential problem.
Yeah, Arturo, thank you very much, because bias can change from country to country, and it's very difficult for everyone. But I want to learn about something for all the world. Is it possible to build an informational system that would be at least as intelligent as a human mind? Is it possible or not? For all the world, this is the same.
That's, of course, the questions of all questions. And I mean, everywhere you go in the media, in social media, these are big discussions up to when AI will be more intelligent than us, and maybe come to the conclusion that they should rule the world instead of humans. I think again, let's go a little bit in the past. The word artificial intelligence was originally coined in 1956 by Claude Shannon, and he defined it making a machine behave in ways that would be called intelligent if a human were so behaving. So in the beginning, and also Turing went this way with the Turing tests to see if AI would behave human-like. And this is the way you discussed that it should be judged if a machine gets intelligence or not. In last time, this changed a little bit, as we all will think that real machine intelligence will be something different than human intelligence. So it would be different than a human intelligence, different than animal intelligence, but machine intelligence just based on logic and mathematics. Coming a little bit back to your question, so due to rising machine power developments, better sensors, yes, the AI will take, I think, better, more precise recommendations regarding pattern detection. They may detect something easier than the human doctor. And based on statistics, they can, I think, make better detections on the long run, but they will never be able to make the perfect decision, because a machine will never be able to know something. They only can statistically measure if different factors are close together or far away together. This is, well, a statistical relation. I think human knowledge is something different, so they will not have, let's say, human intuition. They maybe cannot connect different points which are seamlessly unconnected, which can be done by a human doctor today. And I think this will be the big advantage in the near future. If AI will be able to do this on the long run, in 100, 200, 300 years, who knows? But I think right for the beginning, it will not. So that's why I like to underline that human and AI will work together as a team. Maybe the first level attendance will be the AI, and if the problem will be more complicated, then you get connected practically to the human healthcare expert. And in general, in a perfect society, the human attendance should not be replaced by AI, but it should be replaced by a human plus AI. And coming back to the earlier topic, ethics, finance, of course, I assume that depending maybe on your personal budgets, insurance company will pressure you to not go directly to the doctor, but maybe attend an AI doctor, as the costs will be much, much lower. And in some ways, this is a little bit going back to the roots for AI, because one of the very first applications was in the 1960s called ELIZA, which was an algorithm simulating being a psychologist. So here the human spoke with this psychologist instead of a doctor. As in the 1950s, people had not known that AI is possible, so a lot of them thought that this was a real human behind, but it was really just some codes. So again, replacing a human as a healthcare expert is a little bit where AI started from. If you're curious and look for ELIZA with Zeta, you find a lot of these applications inside the internet. So it's fun. I mean, it's quite primitive from today's view, but in the 1960s, this was really high tech.
Why not? We will think about all things. And Mr. Patrick, it was an impressive, very perfect presentation. Thank you for everything. Thank you. You're telling artificial intelligence in the future what will happen. We will think now and then we want to see you again, and we will talk about the new topics again. Thank you very much for everything.
Thanks to you. It was my pleasure.
Thank you. See you again. Bye bye.
See you.